Well, thank you very much again, colleagues here and colleagues online, for joining to this our second policy webinar organized for by the Technical Network on Poverty Analysis here at FAO. The webinar today is titled "Prepared, Not Just Reactive: Anticipatory Social Protection for a Climate Change for a Changing Climate." Um, this basically just to give you a bit of context, like before this is, as I said, this is the second webinar on policy, but before I think PA, we were organizing more, as the name said, technical webinars on around poverty measurement and poverty analysis. And now we have launched this new format of webinars in which we talk, it's more policy oriented. And these events are organized in link with the Global Alliance for Poverty and Hunger Reduction, an initiative that FAO is a member. And just for those that are not familiar with what is the initiative, it's an initiative launched by the G20 leaders summit to accelerate progress and eradicating poverty and hunger by 2030. And this alliance focus on supporting country-led evidence-based policies and programs by strengthening national and international cooperation, aligning resources, and leveraging innovation to combat hunger and poverty more effectively. So the idea is, and basically the alliance have come up with like several policy baskets, and within every policy basket there are policy instruments that, and the idea for us, for the Think PA, is to contribute in the policy dialogue and knowledge exchange on these policy instruments. And that's why basically today the event is focused on anticipatory action and social protection, which is one of the main policy instruments that FAO is helping to promote in countries. And before I go a little bit more deep on what is anticipatory action and social protection, just to introduce the webinar, I wanted to thank first colleagues that help us in designing and this event, especially Martina, who is here from ESA, who conducted like a very, very quick literature review on the topic, and also the team in ESP division here at FAO, the social protection team, especially Mark Johnson, who provided like a very good feedback on the literature review that Martina did and help us locating these wonderful speakers that we have today with us. So having said that, just a very, very quick introduction on what is anticipatory social protection. With the context, so basically it refers to the integration of forecast-based preemptive interventions, such as early cash transfers or agricultural inputs, with existing social protection programs, such that it will enable assistance to be delivered before a predictive shock. So the idea for it is that it combines the strengths of shock responsive social protection with anticipatory action. So the idea is to create like to be cost-effective mechanism to safeguard livelihoods, food security, and resilience against climate and disaster risks. I will not talk more about that because the first presentation is going to go deeper on what is anticipatory social protection. And for that, like we are very honored to have three, I think I would say, world leaders on this topic. The first one is Daniel Clark. He is the executive director of the Center of Disaster Protection. He has led work on disaster risk and preparedness and financing around the world, and he has advised over 40 developing countries on risk finance and partnership with governments, insurers, and also developing agencies. His focus is on designing innovative financial protection mechanism that strengthen resilience to shocks and crises. Before his actual hat, he was a senior disaster risk and financing and insurance specialist at the World Bank. And he is a chartered actuary with a first class degree from Cambridge, and he has a doctor of philosophy in economics from Oxford. He will be presenting what specifically makes anticipatory social protection different from other programs there, and like to help us understand what are the main I wouldn't say what are the main characteristics of such programs. Then we are also very happy to have with us Ashley Bobble. She is an economist at the World Bank. She's specializing in climate adaptation, climate finance, and the air quality management in South Asia. Her research focused on anticipatory action and flood response programs and labor market interventions. Previously, she led the research agenda on anticipatory action at the United Nations Office for the coordination of humanitarian affairs and and she was a consultant with the Center for Disaster Risk Prevention. She holds a PhD in economics and a master in economics for development as well from the University of Oxford. And she will be speaking about what are the lessons learned on two impact evaluations that she carried out in Bangladesh and Niger. And last and not least, we are also very happy to have here as a discussor Nicolo Lombardi, who is Emergency Rehabilitation Officer here at FAO headquarters. And he is also a specialist, or I would say expert, although he doesn't want to be called like that, but he has worked in the last 4 years helping governments to integrate anticipatory action approaches, such as early triggers, pre-arranged financing, and operational guidelines into existing social protection programs in countries such as Bangladesh, Pakistan, and other Southeast Asian countries. So he will be giving more institutionalized perspective on what are the challenges that he has found in helping governments to conduct this anticipatory social protection. And I think with not further, I just want to remind the audience in online that during the webinar, we encourage you to directly post your questions in the Q&A section that is down there. And later on, our speakers will be reading them, and probably they will be already responding while on the webinar, or they can also decide to do it by the end. We have a Q&A section of around 30 minutes after the presentations of Ashley, of Daniel, and then the intervention of of Nicolo. So yeah, please to put your answers, your questions at any time. With not further, I will give the floor to Daniel, who's gonna be giving the first presentation. Daniel, the floor is yours.
Well, thank you so much. Can you all hear me okay?
Yes,
Brilliant.
perfect.
Wonderful. Thank you. Well, thank you so much for the invitation. I'm the warm-up act. I'm Ashley and Nicolo's warm-up act. As Carlos mentioned, my role really is as a practitioner, and from the policy perspective, I will be talking about some research that we did recently looking at 4 countries and their progress on shock responsive social protection, which is a little bit like anticipatory social protection, but anticipatory is earlier. Um, and I lead an organization called the Centre for Disaster Protection, which is focused on planning and paying for disasters better. So it's really focused on that sort of risk management side, particularly through that financial management lens. You've heard the proper definition of anticipatory social protection. Here's a cartoon that was instigated by the late Pablo Suarez from the Red Cross Climate Centre about a decade ago, actually, which was trying to convey the justification and motivation, the common sense logic for anticipatory action. And if you sort of think back 10 years ago, we really were in a situation where the international system was largely reactive. There were some experiments to become more proactive, but really it was largely reactive. For humanitarian appeals, you waited until the cyclone hit landfall, and then you started launching the appeal, and then governments started sending their ships with physical goods. Really, so much has changed in the last decade in terms of the international approach to responding to disasters, including the logic of acting early and acting earlier, and maybe even acting on the basis of a forecast, not even on the basis of an event. So there's been a lot of progress, but still more to go. There's also more evidence that this logic pays off, that acting early is better for people. It's a better use of public money, where public money is going to be spent, than acting late. And I'm sure we'll hear more from Ashley about that and the sort of really groundbreaking research she's been leading. Um, there has been progress in the international system, but a lot more is possible. If you look at a national perspective for national governments, though, progress is very varied. So you see the most progress in countries that have quite well developed social protection systems, quite clear boundaries about the role of government, quite clear expectations for government responding in the event of shocks. And then from that, an evolution to respond earlier and earlier and earlier. But really, in countries where there are frequent shocks, in countries where there aren't frequent shocks, progress has been slower at national government. So I think one of the messages I want to leave today is there is a real role for the international system and international actors who work across multiple countries, to work across those multiple countries and to share lessons and learning to try to speed up the pace of change at a national level and essentially try to shift the political demand for better use of public money in response to disasters. So that's the common sense logic. What about the economic logic? There are a number of different ways that faster anticipatory social protection can lead to benefits for actual people, for households, for people. Heard one already around faster. Obviously, by definition, if it's an anticipation of the shock, it is faster than response would be if that response was after the shock. But also, if you're going to respond in anticipation of the shock, you really need everything set up in advance. You need to have a very clear decision-making process. It needs to be clear who is deciding go and no go and on what basis. You can't leave it to a political discussion over whether to act, because that will take too long. It will tend to lead to much slower decision-making. So you need clarity over the decision-making process. You need clarity over who is going to implement, who has been given the budget to implement, are they prepared to be able to implement what they're being asked to implement, and then who will pay. You can't run around trying to fundraise for anticipatory action when you're 2 days away from the storm hitting. It will just take you too long to bring in the money, and it will take you too long to get the logistics established. So really, there is if you're going to deliver anticipatory action, it needs to be set up in advance. It needs to be predictable. Now, there are other big benefits from having more predictable responses to shocks, if you're thinking from the perspective of an individual, particularly if that individual understands what support they will get in different circumstances, or what will happen. Some anticipatory action. There was a recent paper that was published by the START network at UNGA earlier this year, which talked a lot about their work on anticipatory action. A lot of the investments that they're making is essentially anticipatory preparedness. So they had an example of, in anticipation of a big storm hitting Bangladesh, there were a lot of repairs to some of the water management infrastructure, and as well as sort of trying to reduce the amount of seawater that gets into fishery, ponds and lakes for aquaculture. So that sort of just-in-time preparedness can also be valuable. But essentially, if you are committed to delivering anticipatory social protection, it can provide. It means that at-risk populations don't need to ask in the event. They don't need to sort of ask. The support is going to be there because it has to be there. It has to be reliable. It has to be predictable, and it can also promote preparedness, because you have to think clearly about, well, whose job is it to be prepared. Who is going to implement that? So really, I don't see any real way of implementing anticipatory action. It's just so fast. I don't see any way of implementing anticipatory action where you make it up as you go along, and that has additional benefits for people if you can also communicate what support will be provided. It can also lead to better national conversations. So as soon as you start making serious investments in things like anticipatory social protection, there needs to be an understanding of, well, what are the risks? Who are they going to affect? Why are we going to respond here, not there? Why is the kind of response going to be this, not that? And that is not just an abstract exercise in understanding the amount of risk and publishing a sort of total dollar at risk value. It can lead to, if done well, that sort of analysis can lead to better conversations. It can lead to better, one of the big political debates is how much should public money be used to respond to disasters, as opposed to how much it is the responsibility of households themselves to manage their own risks. So it can lead to better conversations about the role of the state in advance of the shock hitting, as opposed to waiting until the shock hits and then making it up as you go along. So that process of developing, if it's done in a transparent way, can support better national conversations. It can support better political outcomes, more informed political demand. And it can also, this is more my wheelhouse, but it can lead to cheaper response. So often disasters, the money for response to disasters is reallocated from somewhere else. It's sort of found down the back of the sofa by governments, or by international actors, and that budget reallocations have a cost. It can look invisible, but when you do the sums, it can be very large in some circumstances. We did study of the opportunity cost of budget reallocation in response to COVID, we actually found for some countries the budget reallocation was actually, it wasn't very costly because government had unspent resources. So in Pakistan, for example, it wasn't very costly, but in Ethiopia it was very costly because the government there was spending its budget. It really had to move money away from priority investments and high impact projects to respond to both COVID as well as deal with falling tax revenues as a response to COVID. So planning in advance can lead to cheaper response. It can lead to better use of public funds. The reality, if you look at, so we don't have a lot of data about, or a lot of sort of aggregated data about what's happening at a national level, but there is much better data in a consistent format for the international system. So here's a report that we publish on an annual basis. The next version of the report will actually be published next month, looking at what we call the state of prearranged finance. So this is just the financial side of that. So how much finance is ready to go if shock hits. And in 2022, around $50 million was channeled through anticipatory protocols. This is according to Anticipation Hub, and that actually increased very substantially in 2023 to 200 million. But even so, if you compare it to the total amount of international crisis financing, so not the black, but the second darkest shade there, the total crisis financing, which we define as, so this is ODA, so official development assistance, as well as other financial flows recorded by OECD DAC, which specifically are going to crisis prevention, response, or preparedness. So if for all the sort of ODA and OOF that's going to those going to crises, essentially we term as crisis finance. And as you can see, so in 2022 that was $76 billion over the course of the year. This is part of that is humanitarian, part of it is actually development finance. So a large part of it is development finance that we classify as crisis financing. But of that, in that year, only $50 million was through anticipatory protocols. So it's still very, very small in terms of the scale. And actually, if you look at that, there's another number there, which is about the 0.9 billion, the 900 million. That's the amount that was prearranged, and the rest of that crisis financing was arranged in the course of crises. It wasn't even arranged in advance, let alone arranged through anticipatory. It wasn't even planned in advance. It was ad hoc financing. Sorry, I need to speed up, don't I? Sorry, I'm taking too much time. So 20 minutes feels like a long time until you start it. Okay, I will speed up. So some key concepts. In practicality for adaptive social protection, it's really important to get the money out right. Where is the money going? What systems are it going through? Are those systems prepared? Getting the money in right is important as well. Where is the money coming from? Has it been authorized? Does someone have a budget for it? You can't fundraise for anticipatory action when you see a forecast, it will just take you too long to get the money in. So that getting the money out right, getting the money in right is really important. This final part, this is the bit that sort of is sort of most interesting for the economist to me. This is the risk deal. This is the idea that people in the country know what's happening and what will be delivered to them in certain circumstances. It's a bit like the idea that this anticipatory social protection is a little bit like an insurance. People understand it, people can rely on it. Maybe they invest more in their farm because they know that they don't have to invest so much in precautionary savings. Maybe they adapt their sort of risk management behaviors to lead to sort of higher expected productivity, higher expected growth, because they know that they have this protection in place. So this is really around that final is really around communication and around acceptance and understanding of the people who are at risk. So it's part of not just government's planned response, but also it's part of households' response to that. It's part of households' way households deal with risk. So the just briefly, recent research findings, and again, this was for shock responsive social protection, not so much adaptive social protection. So at a government level, you have many different parts of government, often have many objectives. The same is true at the international space. Where we see shock responsive social protection having more impact, it's when there is alignment and sort of clarity around what is trying to be achieved by it. So take Jamaica, for example, where government has done a lot of work with the finance ministry to prepare finance, but that in advance of shocks, but that finance isn't linked to social protection. So there's no sort of clear link. The social protection ministry doesn't really know whether that money will come to them or not. So the idea that there will be anticipatory social protection response became, obviously it's salient today, but it's, at the time we were doing the research, it seemed quite unlikely. It'd be interesting to see how it plays out, obviously. Malawi, on the other hand, where disaster response is primarily funded by donors, there was a sort of clear statement around what was meant to be achieved by this investment from donors into shock responsive social protection, and that unlocked a delivery which actually so that system has been responding to shocks through the social protection system in response to droughts. Secondly, there is an issue in most countries, in terms of the ability for social protection systems to actually be able to scale in response to shocks. There's a lot of debate. I spend a lot of time in discussion, or there's a lot of debate with social protection experts around whether it's even worth the effort to use social protection systems as the platform on which to build emergency response against shocks, let alone anticipatory, but any kind of emergency response. And this is still very contentious. So there's still a big battleground in organizations that do a lot of work on social protection, particularly on the development side. This is a real battleground topic between those who really believe social protection is about core transfers. There's enough evidence for that. It's really about building political support for those core transfers, and who see using social protection systems for emergency response as a distraction which the systems aren't ready for, and those who believe that there is a political imperative. Governments are going to be responding in response to disasters anyway. It will be better if it's channeled through the social protection system. So let's sort of try to channel that money through the social protection system in an early way as opposed to late. But I think there is a real value added for international actors in this space. A lot of the particularly anticipatory responses that have actually been implemented and have been documented have been implemented through international organizations that have control over the implementation, as well as over the financing and the public financial management side. I'm very nearly there. But this is my final content slide. One of the big topics in financing for crises is whether financing for crises should be unearmarked or earmarked. So government of Jamaica, for example, has arranged a very large amount of finance that can flow in the event of a large shock, and I'm expecting that to be flowing in the coming days to Jamaica. But it hasn't. The Ministry of Finance, that now all sits with the Ministry of Finance. It hasn't pre-committed that to ministries. It hasn't pre-committed that to social protection ministries. So there's a real question around whether whether is the Social Protection Ministry going to be prepared to deal with volume, whatever volume of money they're provided with? Are they going to have done the preparedness? Were there sufficient stress tests in advance for the Finance Ministry to understand whether they were able to respond? I think from my perspective, I see a lot of value in having finance that is earmarked to social protection in advance, where it is, it's clear that this finance would be available for social protection, and then creating that accountability to ensure that social protection systems are those responsible for implementing the systems know they need to be prepared to be able to push more money through the systems. Final two reflections from me. The international system is still primarily focused on long-term development, long-term growth. A lot of the main metrics that we use at the highest levels really do smooth out a lot of the shocks at the national level. So as soon as you look at aggregate figures, it tends to smooth out a lot of the shocks. There's a great blog from CGD recently arguing that we shouldn't care about shocks because if you look at the Second World War, it didn't really hurt economic growth in the long term, and we should really be focused on long-term economic growth, not short-term shocks. I think there is value in focusing on shocks, in part because we know that governments do get involved in responding to shocks. International organizations do get involved in responding to shocks. And if they don't have the house in order, they can really undermine incentives for households to do good risk management. But if they do have the house in order, they can promote good incentives, and they can actually contribute to good risk management and good risk management behaviors, and adapting to changing risks. Anticipatory social protection is not just a technical issue. I think that there's in the 4 countries we looked at, there was limited political support. There were very different groups, but I think there is a real role for international organizations working on this and being transparent, and intentionally as one of the objectives of international organizations trying to improve national conversations and improve demand for risk-informed investments, including anticipatory social protection. Sorry, I've taken too long, but I will stop there.
Thank you, Daniel. Thank you very much for the presentation. No worries for the time. You're almost very good timing. I think now we can give the floor to Ashley, and then thank you.
Wonderful. Thanks, Daniel. You really set the scene there. So today I'm going to speak about 2 studies that look at measuring the impact of anticipatory action and early response. Actually, one of the studies is looking at a shock responsive social protections program that the Nigerian government implemented. So kind of you can see how 2 different delivery partners have delivered an earlier response to both a flood and a drought. So I think it's all well known that these extreme weather events can have big impacts, but the question is, can we improve the effectiveness of the response and the way in which we mobilize financing? I'll start with the Bangladesh case study. So in 2020, Bangladesh experienced the 2nd highest and most protracted flood in the past couple of decades, and it's one of the first kind of. So this slide basically showcases how the anticipatory action pilot happened in Bangladesh in 2020. The blue line represents what was the actual water flow at a central gauging station, measurement station, whereas the dotted black line shows the predicted water flow. Now, what you can see here is that the 2 tracks each other pretty well. And I think the point I really want to emphasize here is that Bangladesh is quite an exceptional situation, and hence why it was a real ideal place to have one of the first large-scale pilots on anticipatory action, because the forecasts are pretty accurate at these central measurement stations. And that's because, in part, there's been decades of investments in hydromet services, in forecasting models, and this is not true in many of the other countries that we work in. For example, we tried to set up an anticipatory action pilot in South Sudan, and we found that we just didn't have good enough forecasts to develop the triggers that would be needed to make informed decisions to release the financing. So I think that's one caveat to kind of keep in mind as we look at the study. The other things to note here is that the government danger level, which is orange, the anticipatory action trigger is a bit higher. So it's really, the idea is that the UN agencies are intervening at a time when the government would be overwhelmed and the need would be much higher. And the first trigger was activated on the 4th of July, about 10 days before the peak flood was forecasted. And And then again, the second trigger was in 5 days before. So the first trigger basically told agencies, get ready, flood is coming. Whereas the 5-day trigger is when there was enough confidence in the forecast itself to be able to say, let's activate the cash transfers. Now, this looks very simple, but in reality, it was chaotic at the time. It was the first time doing this. In Bangladesh, there's been many years of piloting subsequent, and we've definitely got better at recognizing that even if we have all the plans in place, the reality of having to act very quickly is difficult. And so, for example, WFP was frantically trying to call 40,000 households between the 10-day lead trigger and when the cash transfers were made. And you can see the cash transfers are kind of staggered in part because WFP wasn't able to contact everyone in time ahead of the floods. And that's because the floods came much earlier than expected. And there was many reasons, but I think it really emphasizes Daniel's point that to do this well, you have a lot of effort and preparation that happens before the time. The release of the traditional humanitarian response plan only came a month later. So that really gives you a sense of how much earlier this was. In terms of the impact, I think the main thing to flag here is we know that cash transfers help households, vulnerable households, especially to cushion the negative effects of shocks, but there is an evidence gap on how do we use these cash transfers for climate hazards or extreme weather events rather, and how does the timing of these cash transfers really matter relative to these extreme weather events? And more generally, I mean, having worked on this for a few years, especially when I was at OCHA, I realized how few rigorous impact evaluations that even existed in the humanitarian sector. So I think that this was all where this kind of study fit in, where we look at the impact of this one-off cash transfer, which is relatively small in size to these vulnerable households in Bangladesh. I won't go too much into the depth of the methodology, although I'm happy to discuss this later, but we use a quasi-experimental design, meaning that we didn't randomize who received cash and who didn't, but rather we used the fact that because the rollout was going so quickly, WFP had targeted, was only able to target those households who had one particular mobile money provider. But in Bangladesh, there's many different mobile money providers. And so we compare those who received cash through this mobile money provider to comparable households who kind of our control group who didn't have the correct mobile wallet. And we collect data about 3 months later. So all the results you'll see is about 3 months after the flood peak. So what are our key findings? First, just kind of descriptively, we see that households mostly use the cash to buy water and food. Almost all households do that. And then there's a few households who spend it on medicine, agricultural inputs. I think this is fairly consistent with what we know happens in humanitarian responses. But then when we compare those who were in the control group versus the treatment group, we can see that during the flood, which is what we didn't collect data at this point, but we asked them retrospectively, how many days or did you go a day without eating any food? And we see a massive drop in the probability that a household had to go a full day without eating food when they got the cash, which is consistent with the fact that they were able to stock up on food and water. And then these are our key results when we look at a whole bunch of other outcome measures. So the way to understand these graphs is that they're all standardized relative to the control groups. Basically, if you see the dotted line in the middle, that would, if the dot is close to that dotted line, it means that that there isn't much of an effect relative in the treatment group versus the control group. Whereas if it's shifted to the right and the confidence intervals doesn't overlap with that, it means we've got a statistically significantly positive effect. And if it goes to the left, it means it's a negative effect. So what we're seeing is that there's a positive impact on child food consumption. So whether children were able to eat enough meals, it's a very crude result because we're collecting this over phones, increases about 5%. And this is consistent. No matter how we look at the data, it's really robust. So it really seems that their food consumption has been preserved. And that's important given that we know that there's long-term evidence on the fact that disruptions to early childhood consumption, food consumption for children can have pretty devastating long-term implications for their education, employment, etc. We don't see much on adult food consumption, but we see that households who receive cash are much better off in terms of their psychological well-being. There's been 2 studies since this one using a randomized control trial in Nepal and in Bangladesh, and they find pretty much the very similar results to us, which kind of shows that we're seeing very consistent trends coming out of all the impact evaluations on anticipatory action. then we look at some of the mechanisms behind that, and we see that households who receive cash are able to take more actions before the flood. And so that is seen as one of the mechanisms by which we think that cash is helpful, is not just helping them boost food, but that they actually can take some actions, like we see a significant effect on their ability to evacuate livestock. And so they have less livestock loss, for example. So here, asset loss is a good thing, it's negative. We see that they are also able to replant and preserve their crops further down. So there are these livelihood benefits. We don't see much in terms of their ability to kind of mitigate their debt situation or whether they receive additional remittances. But I think these other indicators are pretty indicative of some of the welfare effects that we observe. We collected data 5 months later, and we see that food consumption remains improved, but not really much else on any of the other impacts. And I think this is a general takeaway I'd like for people to take away, that across the now 5 studies on anticipatory action, I keep reading more and more, there's loads coming out. Generally, there seems to be a similar finding that although there are really positive short-term effects and we're really helping households to get through these crises, there's not much in terms of longer-term resilience building. Now, the next study looks at the early response to drought. So this is less of an anticipatory response to drought, although OCHA had coordinated with SURF and all UN agencies to do an anticipatory action kind of response to drought that same year. So we don't have much evidence on that, as I understand, but I think it was interesting to see the two being rolled out in parallel. So this study was being done with the government, and this is World Bank supported, where they supported the World Bank, the government to define a set of triggers to then release payments through their growing shock responsive social protection program to affected households who had experienced rainfall shocks. So I think it would be first helpful to kind of look at the timeline of why we think droughts are important in this context. So typically you have a rainy season between June and September, which is when sowing and growing happens. For these households, it's often their only source of kind of food production for the entire year. And so if there is a drought or weather shock, then their food production or their harvest is lower than expected. And that means that in the run-up to the next harvest, 1 year later, they experience lower income and consumption as their food stocks effectively run low. And typically we see the food insecurity crisis happen during the lean season in the run-up to the next harvest, i.e. during the next rainy period. Now, the traditional humanitarian response is to respond when food insecurity is at its highest, which is during this lean season period, i.e. the next rainy season period after the drought had happened. But at the same time, prices of food go up, and there might be a case to bring the response earlier, especially if households can, say, stock up on food when prices are lower, or if they need to meet the fact that they need to do a whole bunch of sowing and off-season cultivation before the lean season, where they actually have high nutritional needs. And so I'll show you where we do the intervention, but I think here, first I'll just briefly touch on where this was happening. So this was in the south of Niger, which is where most of the agricultural production happens. And we focus on 3 communes or three districts for the RCT, which are close to the capital city. About 4 communes were activated based on a water requirement satisfaction index trigger, which I'm happy to talk about. And there's about 4,000 households in our study sample and about 15,000 households who receive cash. And this is the bottom 44% poorest households in the village, so not just your typical humanitarian targeting. It's a bit wider than that. And so the trigger was activated after the rainy season, the failed rains happened during the lean season of 2021. Cash transfers were, I mean, this is a lesson to be learned. We were hoping to launch the cash transfers by December, but because we didn't have payment delivery systems in place, the government hadn't figured out who they were going to target. There was a whole bunch of steps that had to happen thereafter, which meant that the cash transfers only started in March. So the first set of cash transfers, which is what we call our early short cash transfers, And so this is a randomized control design where we randomize the timing of the cash transfers relative to the lean season. So a third of the villagers get cash in the period before the lean season, a third get it during the lean season, which is the traditional response, and then another third get it throughout the year. So they get it during the pre-lean season period, during the lean season, and afterwards. And then we collect a lot of data throughout. You can see we collected about 11 surveys, high-frequency surveys, which we then kind of pool into data points pre-lean, lean, and post-lean. So all the results I'll show you are looking at snapshots in the pre-lean season, during the lean season, post-lean, and then at an end line 1 year later, which was 2 weeks before the coup d'etat happened. So it was the timing couldn't have been, more timely. And so this is really the kind of main result to take away, and all our other results look very similar to this. So I'm just going to explain this one. The key takeaway is that the pre-lean season cash, which we call the early short, which are these large cash transfers in the pre-lean season period, tend to boost food consumption in that pre-lean season period. But then when it gets to the lean season period, those who receive cash at that time seem to do a bit better, but the people who receive the cash earlier are able to smooth it across the 2 periods. So let me dig deeper into that. So what we have here is 4 time periods: the pre-lean season, during the lean season, post-lean, and then the end line. And we have the 3 different groups. So we've got the traditional response who receive it during the cash only during the lean season, the early short who receive it pre-lean, and then the early long who receive it throughout. And you can see that the blue bar is much higher than the gray bar, suggesting that there's a large positive effect, about 20%, 18%, on food consumption before the lean season for the early short relative to the traditional response. But we see that the early long, those who receive cash throughout, which are much smaller in size than the kind of large early cash transfers, there isn't much of an impact. So the key takeaway here is that we need these large early cash transfers to be able to have an impact on food consumption. And we see the exact same results if we look at food security, subjective psychological well-being, and mental health. But when you get to the lean season, the early short, the blue bar, are no longer receiving cash, whereas the gray bar are receiving cash. And now you see a positive impact for the traditional response relative to the early short. So the guys who are receiving cash during the lean season are doing better off than those who receive cash earlier. But you can see that the levels between the 2 blue bars is not that different. So basically, the households who received cash before the lean season were able to boost their consumption in the pre-lean season, and then they were able to maintain a relatively similar consumption level even when they went into the lean season. So it wasn't like they were doing much worse off when they were no longer receiving cash, which was really a concern that governments had. I'm conscious we're running out of time, so I've got 2 more slides, if I may, Esteban.
Yeah, please go ahead. No worries.
Great. So the final 2 points. So we didn't see any other effects on livelihood. So we saw that households who received the cash were better off on food consumption and food security before the lean season if they received these large cash transfers before the lean season. But we didn't see any other effects on livelihoods, which was quite surprising. Sorry, the one other thing I wanted to point out on this graph is that when you look at the post-lean season and the end line period, you see no differences across the transfer timing modalities. In other words, irrespective of when you receive cash in that year, we don't see significant differences in food consumption, food security, mental health, livelihoods, any results after the harvest, which it doesn't mean that the cash isn't having a positive effect. It just means that the timing of the cash isn't making much of a difference. So what are our key takeaways? The small anticipatory cash improves welfare during the flood and 3 months before in Bangladesh. And so there's really clearly a cost to not acting earlier, especially because we measure results in Bangladesh at the time that the traditional humanitarian response was happening. So if we think about all those differences between the treatment and control, those were all the differences that could have been, all the benefits that could have been incurred if we aren't acting earlier and instead acting as we would ordinarily would. Similarly, in Niger, we see that the large early cash transfers have bigger impacts on consumption and food security and psychological well-being. before the lean season and somewhat during the lean season. The messaging is a little bit more complicated there, so please let me know if you have any questions. But I think the point is that receiving cash earlier helps households to make different decisions that help alter the effect of these shocks, but that varying the timing of these cash transfers in response to shocks is not going to be the key of the panacea to building long-term resilience to climate change. And I think that's really important to note. And instead, you need things like multifaceted economic inclusion programs where you get multiple different buckets of goods to households, for example, has been shown to have more longer term impacts on, say, building resilience and reducing poverty. I think I've covered some of these points already, but the three key takeaways is that we need more experimentation on drought response triggers in particular. Right now, we're kind of the main triggers are being used as looking at kind of millet, what was the kind of the water inputs to millet production or the food security measures, but we know these aren't, there's a lot of uncertainty around these triggers. But even when we worked with the government to develop triggers that they were happy with, when it came to activating it, they started questioning all the triggers. So I think that's always a lesson to be learned, that when it comes to actually having to make decisions based on the triggers, I think there's a lot of work to be done to build the trust around the triggers, including with governments and UN agencies. You need these three things to be able to provide support quickly. If you don't do targeting ahead of time, like WFP hadn't done for various reasons that were kind of out of their control in Bangladesh in 2020, it delayed the cash transfers. If you don't have payment deliveries set up in advance, like in Niger, that delayed the transfers by 3 months. And finally, you need the prearranged financing to be able to be ready for the response. Now, in the UN system, SURF has been working a lot to thinking about how to set up their prearranged financing to support some humanitarian crises that are where there's not enough support. But beyond SURF, there's not much out there yet in terms of thinking about how do we set up the financing models for that. And governments have been, experimenting with disaster funds or insurance mechanisms or catastrophe drawdown options, for example, which is something the World Bank's doing. So how do we set up these prearranged financing mechanisms to be able to get the money to the governments and then or the UN agencies, and then how do you get it out to the households as quickly as possible, which is often a kind of two-step process. Great, let me stop there. Thank you very much.
Thank you very much, Ashley, for this wonderful presentation. Yeah, I think we can go to Nicolas, the discussion. You have 15 minutes, no worries, and then we will have a few more minutes for questions.
Yeah, I think I can be even shorter than that, but thanks a lot for the presentations, which are very interesting, of course, in the findings, but also the kind of recommendations you have coming from these studies. Of course, as you know, as FAO, we are part of this, let's say, movement trying to make assistance more anticipatory and based on early warning systems and forecasts, which is a growing field of work, not necessarily from a financial standpoint, as Daniel was showing earlier, but definitely it is showing the positive results that one would expect, right? We have more and more capacity to anticipate shocks. We have very good early warning systems. We have technology improving, and we really need to work more and more on the political will also to invest based on risks and based on uncertainties. As FAO, we are engaged in more than 40 anticipatory action protocols, mostly for climate-related hazards, drought, floods, cyclones, and most of those are together with partners. The example Ashley gave on Bangladesh, FAO was also engaged in that pilot. and it was done together with WFP, UNFPA, the Red Cross, and coordinated by OCHA. We have many of these examples now active in different countries, and a lot of work done with governments, local authorities around developing these protocols and being sure that everything is ready to go if these warnings come and we reach the triggers. But of course, and just as we speak, there is now Hurricane Melissa in the Caribbean, and there have been interventions done in an anticipatory manner. In the case of FAO, we were part of the interagency framework in Cuba, and our country office was able, together with the government, to deliver assistance before the hurricane made landfall. So the examples continue to be there, and I'm very happy actually that there is a plan to continue having these studies, because this is what is needed also to, on the one hand, inform the program on anticipatory action, but also to advocate for additional finance, which is what Daniel was kind of mentioning at the beginning. In terms of the sustainability of the approach, here is where the social protection component comes in very strongly. And here is Federico here, for instance. We've worked together on various initiatives around linking social protection and anticipatory action, one of which in Asia, in a 3-year program on linking anticipatory action and social protection in 5 countries. The sustainability of this approach comes with the institutionalization, and social protection mechanisms are and should be part of this. As you said, we need these mechanisms can help on the one hand with the targeting, because we can have much more precise targeting and based on social registries which are managed by the government. But then it's also about making anticipation part of the way governments finance disasters and finance disaster risk. If you have a social protection system which is made more anticipatory, it means it's fully embedded into the national disaster risk management and disaster risk financing structures. To do that, we need more and more evidence, we need political will, and we also need to be realistic that not all the social protection system may be ready to embed an anticipatory component. In our experience in this program that I was mentioning, we have seen how we were able to work with the government to improve these systems and make them more and more suitable for anticipation. But then the kind of delivery that we could do was mostly working side by side with government entities to deliver using also the social protection mechanisms. So not a full integration yet. An example was in the Philippines, where FAO worked together with the Department of Social Welfare and Development, the SWD, ahead of drought in 2023 to deliver assistance to at-risk households. And so in this case, there was the government, the SWD, implementing cash for work, FAO delivering cash and delivering tools to boost food production ahead of drought. And it was done through the 4Ps program of the government. Still, not a full integration, but a continuous testing of this approach. The more we can reach a level when these systems, by default, can expand based on forecasts, the more we get to what success would look like in terms of institutionalization of this approach. And in the Philippines now recently, there was a law passed that allows for the disbursement of funding from the government based on forecasts. And this is really a landmark moment because it goes exactly in the direction I was mentioning. And just I mean, another example was in Laos, PDR, where thanks to investments that also the World Bank was making to support the national system and the social registry, FAO was able to work side by side with the government to test the use of anticipatory action again ahead of drought, and especially in that case, the registry was used to improve the targeting, and FAO was able to support with adding some vulnerability elements to the social registry to make the targeting of households more precise. And this is not something secondary at all, because when Daniel said at the beginning, we need to ask ourselves, are we directing the funds in the right place and for the right people? When it comes to anticipating something that has not happened yet, this becomes even more crucial, that we are very sure that the funding is reaching people who, when the hazard strikes, are going to be heavily affected by that hazard. Because politically speaking, it's a big decision to say, I'm targeting these households and not those, based on a forecast. That's where the social registries can play a huge role in that sense. And just to conclude, to say that, of course, here we've been talking a lot about cash, and indeed, this is one of the main entry points through the social protection systems to reach people very fast ahead of shocks. What I would advocate for is always to make sure that and the two examples I gave were about cash plus. So on the one hand, providing unconditional cash, it's crucial, it's timely, and it's part of how we can link with social protection. Adding also the plus component, which is in the case of agriculture, it's stress-tolerant varieties of seeds, training on water management. In the case of Bangladesh, FAO was distributing waterproof drums to store seeds before the floods and make sure that households could restart producing as soon as the flood water would recede. There are many other examples of this in-kind assistance that, coupled with cash, can give even a stronger effect. And this is what's coming out of our evidence, that families are asking for this combination of cash and in-kind assistance, especially in contexts where you may not have, it may not be easy to access certain inputs that you need to protect your food production in the midst of a shock. And so maybe you don't have enough access to markets, or certain inputs are not available in that moment locally. We have seen how distributing this support combined with the cash can give an even stronger result.
Great. Thank you. Thank you very much, Nicolo. Well, we can start with the Q&A section. And to start, I would probably give the floor to the people that it's here to start like the room, and then we have a few questions on the Q&A. So, well,
No,
who wants to start?
Okay, Thank you very much for the speakers for their informative presentations. I have a few questions. The first one is for Ashley. So we saw how difficult it is to act fast and to target the right people. So I'm wondering, in the context of a survey or even an experiment, how do you mitigate the risk of collecting data on from households that won't then be affected, or yes, they will be, yes, maybe no one of because the data has to be collected before. Now you don't have 5 days to collect the data from the household. So how do you mitigate the risk to sample the right people, basically, for the analysis? Then in terms of the question more general, maybe for Daniel, is on the cost benefit. So you explained, you had a slide explaining the rationale now for the economic case, but I think that what is, to my knowledge at least, what is still missing is quantify this cost benefit of acting early. So, I mean, what do we know, and if someone is conducting this type of studies, and especially within this context, it would be interesting to also understand the cost benefit of giving cash only, in kind only, or maybe both. This I think would help a lot, no? And also in this context of shrinking resources, having more concrete numbers on the cost benefit could be helpful. And finally, also, I think Ashley touched upon that, on the impact of early action on resilience, on longer term outcomes and resilience. If you could elaborate a bit more on this debate, I think it's very interesting. And or maybe even you, Nicola, I don't know, because I understand that there is a willingness to for this intervention to have a long-term impact, but oftentimes they are small intervention, like maybe $100 of cash transfer. So it's a big shot, to say there will be affecting long-term resilience. So if you could elaborate a bit more, any of you, on the status of this debate. Thank you.
I think we can go ahead, like collect one more. Okay.
Right.
Yes, please.
Thanks. So my question is a little bit for all speakers and also Nicola's discussion. The question is related to how in these two research, but also more in general your experience, you see the role of international organizations and governments in terms of pushing for early warning or forecast-based early action, whatever action can be implemented through a trigger system. In the sense that I think what you just said also is often we see small-scale interventions, but and I think this could be extremely instrumental. The example that Nicola brought, it's key. In the Philippines, there's been a number of pilots that brought to the parliament to pass a bill for the declaration of imminent disaster, which allowed to download cash ahead of a shock through government funding and with government program. So this is the best case scenario, having a number of pilots that takes to an actually policy change. But often we also see in contexts where there is higher fragility than the Philippines, some international actors invest much more in direct implementation. I would like to get your idea. Does it make sense, or should we more stick to really showing how the system works and then try to trigger it directly into government program? Thanks.
Thank you. Maybe we can start by Ashley and then Daniel, please.
Great. Okay, so a couple of questions. Maybe first on targeting. So the gold standard here would probably be to have comprehensive registries of sorts, where you already have existing registries where you've identified who are the most vulnerable households. Typically, you would use, proxies of vulnerability, whether it's, poverty, proxy mean test scores, for if you think that poverty is important. I know different agencies, depending on what they're focusing on, will use different vulnerability criteria. And then you would overlay, for example, geographic, some kind of satellite data or whatnot to be able to measure what is the hazard at a geography level. And then you kind of overlay those two to then say, okay, we're going to target these villages or these geographies. And within those villages, we know who are the most vulnerable. In practice, I think it's quite hard to do that in the UN system because often you don't have the money to do these kind of preparedness steps to have these comprehensive registries in place. I think the Bangladesh pilot, or the Bangladesh Anticipatory Action Framework, is a really good example of how over time, the fact that the framework has existed, this Anticipatory Action Framework, has meant that the different UN agencies have been collaborating in a way that I think has been deeper than in other. I haven't seen a huge number of humanitarian interventions, but it seems like there's a deepening collaboration between the UN agencies. So what I mean specifically is that since 2021, I think WFP has taken the lead along with a few others to set up this comprehensive registry where they've asked all the different agencies to share their data and set up one kind of beneficiary list and trying to standardize it across the different spaces so that when when the triggers activate, they can then, they have this kind of existing registry in place. I know it hasn't been without its pitfalls, and I'm sure Nicolo can reflect more closely on that if you know anything about how that went. But I did see this registry being developed in 2021 and 2022 and I think even in 2023. And that seemed to be a first step towards trying to get this in place. And I think they had about 150,000 households in that. In terms of longer term resilience, so I can speak to the Niger case because there's actually quite a lot of studies in Niger that the World Bank various academics have done in coordination with the Nigerian government and the World Bank, because they've been rolling out the social protection system there for quite a few years. And what we've seen is that the programs that have had most success this is more from the government side in terms of building long-term resilience to climate, to extreme weather events like drought, have been multi-year cash transfer programs, so having social protection systems that are multi-year. Now, this is not very relevant to humanitarian actors, but is relevant to the social protection debate that Daniel was talking about. And then second, having kind of cash plus, but at a bigger scale and looking a bit more ambitiously at what that looks like. So I think that's, Nicolo had touched on that briefly. There was another question saying that looking whether or not we were surprised by the lack of significant difference across the timing modalities in the post-lean period. Honestly, we were surprised. There has been a lot of evidence, not in a drought context, but just generally when you have seasonality, that if you give cash if you give access to liquidity to households earlier, they can then boost their agricultural production, and then they are better off in the longer term. That didn't happen in our context, and we've been wondering why that's the case. We don't see any differences in the livelihood activity. So that is the main mechanism or main reason that we give for why we don't see the longer term resilience, is because we don't see them making differences, different choices around intensifying the agricultural production. They don't have a bigger harvest after the lean season. So there's no reason why the effects should last if all the money is being used to kind of smooth food consumption. And I think that might just be because we're focusing on like a very, very impoverished set of villagers who have never received cash before. They've never received any kind of form of social protection before. Whereas some of the other studies that I mentioned, which are more in kind of development policies, are in much higher income contexts. So I think that's what you would need to see, is some diversification of livelihoods, some investments to happen to be able to have those longer term impacts. And finally, I think there was a question in the chat about whether you've seen any kind of anticipatory action for animal disease outbreaks. I don't know about that specifically, but I know as part of the 12 kind of original pilots that the different UN agencies were coordinating on under the umbrella of kind of these SURF-funded pilots. There was one for cholera in the DRC. And it's interesting because there you're trying to mitigate, I think it's similar in the sense that you're trying to mitigate the escalation of an outbreak of, say, cholera. You could say the same for animal diseases. And so you don't necessarily see the impact of that. You can't really measure it because the whole point is you're trying to prevent that escalation from happening in the first place. So it's really hard to attribute, in some ways, anticipatory action to what it's doing because you can't even measure the impacts. Well, you can. I mean, that was what we were thinking a lot about, is how do we show the counterfactual of what would have happened if we didn't have that in place. But I do think your question about like what happens if the shock or whatever event, like what if there was no outbreak, what if there was no flood, then there's been a big focus on focusing on no regrets kind of interventions, which would be good for any households, regardless of whether the shock happened or not, because that would help boost their kind of welfare. Sorry, that was quite a long response. Back to you, Esteban.
Thank you, Ashley. I think just following up, like there's like a comment in the chat as well related to technical. It says like, how do we deal with the issue of a control group collecting from a true control group? Similar exposure and vulnerability is generally unethical and often not permitted by law. How do you suggest we go about this? This question was asked by Silk.
Is that question for?
It's a question for Ashley, sorry. I wanted to give you this before going to Daniel. Yes.
It's so, I mean, I guess you're talking about whether there's a kind of data collection question and then how do you identify the control group? So I guess I come from a world where you do a lot of randomized control trials, and I think we felt that in the Niger context, it was ethical to randomize the timing because we were trying to improve it relative to the status quo. And it was really unclear which of these would be better for households in the long term. Now, I know when I spent the year with Acha trying to think about how do we develop the research program around anticipatory action, I mean, it's challenging in a humanitarian setting, but I think that's where these quasi-experimental methods are really useful. And you're always making decisions about excluding someone or something implicitly. And I think the point about the quasi-experimental designs is saying, well, we can make that assumption more explicit, and then we can use it to actually study the impact with a view to try and improve the design of these programs over time. So for example, at some point there was a discussion in Niger about FAO and WFP coordinating to provide seeds and cash at the same time. And I was saying, well, why don't we go with providing some people with just cash, some people with seeds, and then define this overlap where we can provide some with both. And if you do this in some kind of random way, then we can at least measure whether this would work or not. And this is something, as I understand, hadn't been done before. So it was a new phenomenon. And I don't think, it wasn't like, it wasn't withholding support from anyone. Similarly, often like the way we target, you use like, vulnerability scores. And if you're above a vulnerability score, you might get the intervention, and if you're below, you don't. And there's methods where you can compare people just above and just below to look at, and then you'd think that they're quite similar in their vulnerability, but then you can measure the impact of the intervention. When we do the data collection, of course, you always ask for households' consent to participate, and there's zero obligation for them to participate in the survey. So you make it very clear that this is voluntary. This is that they're not, and then you make clear what the benefits and gains are. And of course, you might say, well, some people might participate because they hope they're going to get something in the future, but you make it quite clear in the consent form what they can expect, and then you have to trust that they're giving their consent willingly in that situation. But it's a tricky, I mean, obviously ethics is important and one that we should keep debating whenever we do these studies.
Thank you, Ashley. Now maybe we can go for Daniel. Please.
Of course, yeah. So on acting early, so one of Ashley's co-authors for the Bangladesh paper, called Ruth Hill, wrote a nice paper called A Chronology of a Disaster a few years back, which was trying to do a literature review on the evidence specifically on this question of acting early. For me, the most striking finding that came out of that review paper was a lot of the best evidence for the impact on the timeliness is around nutrition. And she had a sort of a statistic that a 1 month increase in the timeliness of response led to a 1 percentage point increase in overall lifetime income, or 0.8% increase in overall lifetime income. And all of this was driven by stunting and by nutrition effects. And by, if you have the faster response, you get less stunting, and stunting is incredibly bad. So it's a sort of, I guess, a sort of non-linearity in that impact. And I don't know, I'd be interested in Ashley's views about whether that has now been, that was a few years ago, that paper, whether that still holds true. But in terms of that evidence for acting early, there is I certainly have in my mind a sense that, when it comes to nutrition and nutrition impacts, there can be very big benefits from that extra month early, because short-term deprivation can lead to long-term impacts. I would say that it is quite difficult, and Ashley sort of presented these studies, which made it look simple, but it is quite challenging to do studies on risk and whether investments in risk management make sense. And the approach that Ashley sort of presented was a bit like a sort of disaster hunting. You sort of have to set something up and then see if something happens, and if it does, then you're able to do your research. So it's sort of a researchers turning into disaster chasers. But there are some pretty there's a pretty astonishing pair of evaluations in Mexico for Mexico's previous system for disaster response, their fund for responding to disasters, and a lot of the benefits from that weren't around the timeliness. I think a lot of it came from, well, it came through timeliness, but a lot of it was around making everyone clear whose job it was to do what, particularly within government, but also between government and people. And one of their key findings was that this was a scheme that essentially reconstructed public infrastructure and low-income housing. Mexico is hit by like 50 big events every year, so it's sort of a lot of damage every year. And but the key finding was that just the health benefits alone of the scheme were enough to justify the entire thing. If you use the government's how much they're willing to pay for a quality adjusted life year, just that the health benefits alone pay for the entire scheme. So really, really huge. And a lot of that was around clarifying what is the role of federal government, what's the role of state government, and sort of essentially getting that faster action. But that wasn't anticipatory. That was moving from waiting 2 years to figure out who's going to rebuild a road to doing it much, much faster than that, because you'd sort of decided in advance, you decided ex ante who was going to rebuild the road. So I think this the methods are challenging on understanding the impact. I think so it's maybe not surprising we don't have better evidence, but we've seen probably two of the best papers that are out there, or two of the most careful papers that are out there being presented today. On the role of international organizations, my background is on the development side, so my instinct is around international systems role in enhancing and supporting government response to crises, but there obviously clearly is a role for substituting for government support to crises in some contexts. I think in this area of sort of risk management and linked to adaptation and linked to but it's quite challenging. I mean, Ashley sort of talked about a lot of the challenges and reality with doing this. And one of the challenges, you need really good public financial management. You need to actually, you need to know the money will be there and will come when it's necessary. And most governments, most line ministries who deliver social protection, they just don't have that mechanism available. The finance ministry just does not have a budgetary mechanism where they can pre-commit to a social protection system that they're going to channel, or program that they're going to channel additional money through it in the event. They can't even commit to deliver this year's budget, let alone a shock responsive. So I think there really is there's a key role for international organizations in helping provide that certainty in the same way, and it really is solving a commitment problem. So providing that, money will come, so prepare for it, and we're going to do stress tests to sort of make sure everybody understands how prepared we are for this. So a combination of stress tests as well as financial, pre-arranged finance where people can rely on it, I think are really important. I think also risk management, a lot of public sector risk management can look like you've blindfolded 4 different people and asked them to paint a room. It looks like a total mess, because collaboration between ministries often doesn't work because it's different ministers, and that gets into the political domain. And a lot of what we've learned about anticipatory action has been from international organizations who have control over the financing, the PFM, control over the logistics, and who are who have a principles-based approach. And those principles are often humanitarian principles, but it doesn't have to be, help to bring everybody together along a common objective. And I think there's a real role for international organizations in learning and in sharing those learnings and in submitting themselves to evaluations, and including rigorous impact evaluations. Governments are very unlike, there's very little in the way of rigorous impact evaluations of disaster response by governments, and actually very little rigorous impact evaluations of humanitarian assistance. But with this prearranged finance, that we are starting to see some rigorous evaluations, and you can learn a huge amount from a small number of careful studies. So I think there is value in that learning, experimenting, learning, and I think there is a role in supplementing. We've just the organisation I lead, we've had a 3-year project in the Sahel in 5 countries, including Niger, actually 5 countries, with the World Bank on adaptive social protection. And very few of those countries has there been much progress on social protection system, government social protection systems being able to respond quickly to shocks. But you have seen a lot of progress from the likes of WFP and UNICEF. So I think there just is that pragmatic sense that organizations with better public financial management are able to do an awful lot more. And yes, you have international organizations like the World Bank that is able to lend its balance sheet and offer prearranged finance. But then you do have humanitarian organizations who are able to arrange the prearranged finance as well as get the logistics right. And I think there is value in both. And often having a really good example of something working really well and a really good story is as powerful politically as a bunch of academics sort of saying how it should be. So demonstrating that it can work is really powerful. And humanitarian organizations have been doing that. Ashley mentioned OCHA. The first impact evaluation was with OCHA. You've also got the Red Cross is doing a lot of this, as well as organizations like the START Network.
Thank you very much, Daniel. We have one more question, but should we go, or maybe we have a little bit like yeah, we can take the last one. It's for Ashley actually, and it's on the Niger study. So it's from a colleague, Kamran. He's asking, can we clarify the timing for Niger study? The effect that we saw in the pre-lean on consumption scores showed that the people receiving only had higher scores, but the people who received it slightly later had high scores as well, but not as high as the early receivers. Where the 2 groups, early and later receivers, had similar scores after 6 or 9 months. So Ashley, if you can elaborate in the graph, thank you.
Yeah, no, thank you, Cameron. I think you really hit the nail on the head. And in my short time, I wasn't able to kind of pull out all the nuances around this. So thank you for raising this point. So your understanding is correct. So basically what you can see here is that those who receive the early short do better than those who receive the traditional response during the pre-lean season, but then the reverse flips during the lean season. So those who receive the traditional response do better than the early short. Now, what we do is we test whether this arrow here is significantly bigger than this arrow here. And we find that this arrow here is much larger than this. So the increase that the early short receive is much bigger than the decrease relative to the traditional response. And the levels, so what we interpret by that is that the relative impact of receiving the pre-lean is much larger for the early short guys than it is for the traditional response guys in the lean season. But more importantly, we can't really, you can see it a little bit here, but it's not super clear. But the levels here, even though it goes down a little bit, it's definitely not going back down to the level that they would have been, that they could. We don't know what the counterfactual could have been, like what the level would have been without having had any cash before. That's the problem with this whole study, and that's because we didn't want to have a pure control group, because that was seen to be unethical in this context. But so we can't say what would have happened if they didn't have the cash, but we see that if you, they definitely do go down a little bit, but the difference between these 2 levels for the blue group, it's insignificant. So what the messaging we want to frame is that there is massive positive benefits from receiving the cash earlier on in the season. And if you hadn't given the cash, there would have been all these positive benefits early on that wouldn't have been accrued in those 3 months. And then going into the lean season, they're not doing much worse off relative to the pre-lean. So they seem to be achieving some kind of more stable food consumption smoothing over time, which is kind of what we see is instead of having such fluctuating consumption like the gray bars. So it's a bit of a nuanced story, to be honest, but we see the positive benefits in the pre-lean as being really beneficial, and then the fact that, yeah, the benefits, the traditional response is much smaller in the lean season, to be indicative that there seems to be some positive benefits from getting large early cash early on. I hope that, and then the fact that you see no differences later on suggests, I mean, that kind of links to some of the other points I made about livelihoods, but at least no one's being, I guess, made worse off. I also just wanted to quickly flag, in response to one of the questions about international organizations and how do we think about integrating anticipatory action in governments, I think WFP specifically, but maybe FAO have been involved in working with the Mozambican government to build in anticipatory action as part of their disaster response plan. And I think that's maybe a really interesting example to look at into more detail about how these two systems can be merged together. And like Daniel said, like there's really a coordination mechanism going on here where they're trying to coordinate the humanitarian actors and the government so that when cyclones hit Mozambique, there is a coordinated response. So I would say that's a promising demonstration example if you want to look at what that looks like. Thank you.
Thank you very much, Ashley. We are a bit ahead of the time, but like Nicola wants to give a little.
No, just to very, very shortly complement this and to say exactly what Ashley said about integrating into the national systems. Yeah, in Mozambique, also FAO is working together with WFP, the Red Cross. That's one very good example of working with the government to embed anticipatory approaches in disaster management. And it answers a bit the question of, I would say, why one could have the question on why are we not seeing necessarily longer term benefits. So the thing with this approach on anticipating shocks, we're talking about the last resort. It's an early warning, and you may have 7 days, 10 days, 2 weeks. In the case of drought, you can go to 2-3 months seasonal forecast. It's really all you can do in that moment in time. If it's not embedded into medium to longer term resilience work, development work, it becomes useless because, of course, I don't want to call useless something that is allowing people to produce and eat food during a crisis, but it's definitely not going to address the root causes of why these people need assistance ahead of a drought, which may not even be an exceptionally catastrophic one. So unless we consider these approaches as a last resort to be embedded into a wider strategy, we are definitely missing the point on how this can contribute to lifting people out of poverty and out of the conditions that make them so vulnerable. That's why social protection can be also one of the instruments to make it become part of such larger strategies.
Thank you, Nicolo. And want to thank once again to Ashley and Daniel and well, Nicolo again for joining the discussion. And yeah, we will be distributing the recording as long as with the slides, the participants and the people that registered. Thank you very much.
And also the
And the literature review, but like that will come a little bit later because we have to fine tune it with the insights that we got today. Thank you very much.
thanks everyone.
Thank you. Nice to meet you. Bye.
Thanks, everyone. Bye-bye.